I am Dr. Deepak Jha, and I am the clinical lead of breast cancer surgery in the Department of Surgical Oncology at Artemis Hospital in Gurgaon. And of late, we have definitely seen an increase in the number of cases of breast cancer that is there in our country. And this increase has not stopped. In the next few years, or probably this coming decade, this increase will maintain its speed. So as of now, as per the official figures that we have, we get about 1,40,000 new cases of breast cancer every year. And unfortunately, we do have about 70,000 deaths due to breast cancer every year. Now, this is just the data that we get from the official streams. There are probably going to be a lot more ladies which do not fall into these cancer registries, and hence this number is bound to be much, much more. Another alarming aspect is, whereas in the West you would see breast cancer occurring more in 50s and 60s, in India, especially in Delhi NCR, our peak age is close to about 45. And if we go further northeast, this average or mean age falls further down. So we are seeing cancer which is more aggressive in much younger age as compared to the Western world, and which is also increasing at a rapid number. We're still yet to get or pinpoint a specific focus as to why this is increase in there. We're probably matching more and more towards the Western data, where the risk is as high as 1 in 8. In India, probably at least in the major metros, this risk is close to about 1 in 22, which means that 1 in 22 ladies do have the risk of getting affected from breast cancer. So probably as our lifestyle is matching more towards the Western lifestyle, we are seeing increasing intent. Whether it's because of the pollution, the chemicals that we face, we still yet to pinpoint a specific focus for that. Broadly, the cause of breast cancer can be of two types. One is the genetic, in which there are genes that lead to breast cancer or ovarian cancer, which happens in about 10% of the cases. In 90% of the cases, we are not able to pinpoint a specific cause. So in these 90% of ladies, nothing can be done to prevent the disease, but a lot can be done to identify this disease at a much earlier stage. In the patients with genetic inflictions like BRCA1 gene or BRCA2 gene, we do have the options of certain preventive surgeries that cuts down the risk of breast cancer or ovarian cancer by 90 to 95%. But yes, in majority cases, all we can do is early detection, but not prevention. The most important thing is something that a lady can do herself, which is a simple breast examination. Now, we all are aware about breast cancer, we all fear it a little bit. We all spend hours and hours on internet, but I'm sure despite all this, we have never actually thought to look up on the net how to do a breast self-examination. If a lady were to regularly do a breast self-examination, she will be able to pinpoint these lumps that form at a much earlier stage. In India, we are still seeing a lot of ladies that present to us at a well advanced stage, and which leads to a poor prognosis. Breast cancer in early stages has got very good cure rates, and in fact of late we have started to decrease our treatment if we catch the disease early. So breast self-examination is the most important, especially in ladies under the age of 50. After 45 or 50 years, annual mammography is recommended. So breast cancer is one of those cancers in which we have the maximum amount of developments in therapy over the last few years. Now our whole aim is to have as minimal mutilation as possible and to give a treatment which is adequate enough for the lady. So in surgery, our stress is mainly upon breast conservation and if need be breast reconstruction. We are doing surgeries where we preserve the entire skin and the nipple, and we just remove the breast fat, and that fat is replaced by the body's fat from other areas. We mix the techniques of oncosurgery and plastic surgery, which is called as oncoplasty, which helps us to give us hidden scars or very minimal scars, so that once the patient is treated from the disease, she is not reminded of the disease by the scars. As far as chemotherapy advancements and radiation advancements are concerned, again the emphasis is upon trying to find out which lady requires what. We individualize the treatment as per the patient's tumor, so that if the chemotherapy can be avoided, we avoid it. If the radiation duration can be decreased with newer methods, we do that. So yes, treatment has definitely increased, and the aim is that the patient goes back to her home having the same body image with which she presented, but just without the cancer. Definitely. So like I said, most important is breast self-examination that needs to be done every month. It will hardly take 2 or 3 minutes to do that, and every lady should do that roughly about 7 to 10 days after her periods. Apart from that, a routine annual mammography or a clinical breast examination are the other methods that can help us to pick this disease early. Artemis Hospital takes cancer very seriously. It was one of the earliest hospital in NCR area which established a cancer center, and now as advancements have come, we have an organ specific oncology department here, where every consultant focuses only on one area, because excellence can only be brought upon by focus. So if I focus on one area, I'll be able to keep abreast of developments and be able to deliver a much better results to the patient. At the same time, Artemis Hospital regularly conducts camps. Artemis Hospital has its own mobile bus with mammography machine that regularly goes to the outskirts to various villages and conducts camps and does the mammography screening for them to be able to diagnose. Apart from this, we regularly have events that try and spread the word about awareness and not to fear from cancer. Thank you so much.